We're here at Faith Regional and getting ready to talk about breast cancer, specifically surgery. Let's meet one of the surgeons. I'm joined now by Dr. Kinzie Norris, a breast surgical oncologist at Faith Regional Physician Services. And when we talk about breast cancer, we start at the beginning with diagnosis. What does that look like?
Sure. Well, typically a diagnosis will either first begin on a patient's screening mammogram, so the one that they have once a year. Most women are diagnosed that way, where they haven't felt anything has changed or don't even know that something is wrong. The nice thing about mammograms is that it can pick up things before we even feel it. The other diagnostic procedure is when the woman actually feels a mass. And then she goes to her doctor and lets the doctor know, and then a diagnostic mammogram is performed.
And early detection is always so important.
Absolutely.
And the mammogram is a great way to do that. Why is that so important?
Well, mammograms are really important because they can decrease the mortality or the death from breast cancer by anywhere from 20 to 30%.
And you're a surgeon, so when you get to that point where surgery is necessary, what are the options?
In general, there are two options for breast surgery. Typically, it's either a lumpectomy or a partial mastectomy, which just means that we remove the lump with a normal rim of tissue, meaning we don't want to leave any cancer inside the patient. It's also a mastectomy, which most people are familiar with, where that just means that we remove the breast tissue on that side. They can opt to have the other side removed as well, but that just depends on the patient's preference.
Dr. Shashikant is a plastic surgeon here. How does he factor into the process?
Yeah, so it's really nice here at Faith Regional Physician Services. We're actually in the same office and can see patients the same day. So typically when a breast cancer patient comes in, she'll see me and then have an examination by him, and he'll talk about her reconstruction options, either with a mastectomy or even with a lumpectomy. Sometimes women who have larger breasts want to have a reduction or a lift during the same time as their cancer surgery.
Well, Dr. Norris, thanks so much for joining us today.
Thank you very much.